Hey, you guys, welcome to day 14 of our March Madness practice questions. Y'all are doing so well, and I appreciate your participation. Before we get started, I always like to do my introduction and disclaimer for my material. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I have been receiving a lot of feedback from so many new members as YouTube wasn't my main teaching platform. And so I'm new to you guys, but hey, y'all. I'm Dr. Brittany Weinstock. I am a family nurse practitioner. I'm the founder and CEO of the Nursing Studio, where I assist nurses and nurse practitioners with being successful on boards or in practice. I'm so happy to have you a part of the Nursing Studio crew. You're always welcome here. I have been doing this since 2015, helping thousands of nurses and nurse practitioners internationally with various things, review books. The current one is my third edition of my review book. We have the ebook and the paperback. I do online courses, I do videos, virtual review lives. I've done live in person reviews. So, yeah, I'm all into teaching and helping you guys get to where you need to be. Look, these are designed to help you be successful on boards as well as in practice. That's the whole thing. And then, we're a family, so even when we practice, having that circle so that you can reach back out if you need assistance with anything. My background is cardiology, so most people reach out to me about that. But yeah, that's a little bit about me. And then I like to always give a disclaimer before I get into it that we know there's no absolutes in medicines. We treat on a patient by patient basis. So treat this material as such. I provide you questions based on the current guidelines that are on the actual exam that we're testing right now, okay? So that you are prepared in that fashion. And then if I'm speaking on current practices, I will always say that to assist you so that you're not getting that confused, okay? All right. With all of that being said, let's get into question number one. All right, so question number one states the nurse practitioner is explaining to the NP student about lab values that contribute to the diagnosis of type 2 diabetes. All of the following are correct except A, fasting glucose greater than 126 milligrams per deciliter, B, A1C greater than 6.5%, C, glucose tolerant test greater than 140 milligrams per deciliter, or D, random glucose greater than 200 milligrams per deciliter. Take a minute and tell me what you got in the comments. All right, as always, I recommend reading the stem of the question first so that you slow down and ensure that you're answering what is even being asked of you. So, the stem of the question here states all of the following are correct except. All right, so what are we even talking about? The nurse practitioner is explaining to the MP student about lab values that contribute to the diagnosis of type 2 diabetes. So, how do we diagnose for type 2 diabetes? Is A, fasting glucose greater than 126 milligrams per deciliter a determinant for diabetes when we're thinking of diagnosis? Yes, that's correct, right? So, we would keep that. B, A1C greater than 6.5%. Yes, that's correct. We'll keep that. And I know that guidelines tell you greater than seven, and that's more so on the management purposes um, of diabetes, the goal that you're trying to reach. But for your diabetics, but we're speaking on what's going to help us diagnose diabetes, right? So it's still stating A1C greater than 6.5% on the current exams, okay? C, a glucose tolerance test greater than 140 milligrams per deciliter. That sounds about right. Is that correct, you guys? No, so your answer is C because that's the incorrect one, right? D, a random glucose greater than 200 milligrams per deciliter is correct. But a glucose tolerance test, and this is where you need to know the difference. A glucose tolerance test greater than 200 milligrams per deciliter can give you the diagnosis for diabetes, type 2 diabetes. A glucose tolerance test greater than 140 milligrams per deciliter, like that's mentioned here, is that cutoff for a pre-diabetic diagnosis. So remembering those things for pre-diabetes, it's anywhere from that 6 to 6.4% on A1C. For those fasting glucose, anywhere from 100 to 125 milligrams per deciliter. for your fasting glucose is a pre-diabetic diagnosis. And then for that glucose tolerance test from 140 to 199 milligrams per deciliter, that's a pre-diabetic diagnosis. Now, what we're doing here, type 2 diabetes, remembering a fasting glucose greater than 126, a A1C greater than 6.5%, a random glucose greater than 200 milligrams per deciliter, and a glucose tolerance test greater than 200 milligrams per deciliter. Okay. All right. Let's get into question number two. Question number two states, a patient presents to the office today for follow-up. The patient has been diagnosed with GERD. How should the nurse practitioner treat? Is it A, famotidine, B, an antacid, C, omeprazole, or D, a Prevpac? Tell me what you got in the comments. All right, stem of the question states, how should the nurse practitioner treat? So, when we're treating anything, you got to take it back and see what the diagnosis is. Here, you're not having to determine your differential diagnoses because it's already provided for you and let you know there's a GERD diagnosis. Now, C is your answer, omeprazole, knowing your med classes. That's a proton pump inhibitor. When there is a diagnosis of GERD, a PPI, your proton pump inhibitor, is your first line therapy, okay? We don't need to go through any of the other steps to kind of gauge and see. We go directly now to PPIs. Now, where people get so mixed up is if they're just speaking symptomatically how to treat it, you treat the symptoms on that. But if there's a diagnosis of GERD, you go with the PPI first. All right. Question number three states the nurse practitioner is planning to initiate a triptan for a patient to treat migraines. She is considering contraindications. All are contraindications except A, PVD. Is it B, severe hepatic and renal failure? C, MAOIs, or D, pregnancy? Take a moment and tell me what you got in the comments. All right, stem of the question states all are contraindications except. So we're talking about triptans here. The nurse practitioner is planning on prescribing a triptan to treat the patient's migraines, and they're trying to figure out which one is not a contraindication. So A, PVD, no, that's correct. Peripheral vascular disease is a contraindication of triptans. Severe hepatic and renal failure, yes, this is a contraindication of triptans. C, MAOIs. Yep, that's a contraindication of triptans also. And D, pregnancy is the answer because triptans are actually deemed safe for pregnancy and while breastfeeding. So you can prescribe triptans. The main thing you need to remember that, triptans work by binding to the serotonin receptors. And because of that, it causes that vasoconstriction of the cranial arteries. Because think about it, when they're having these severe migraines, there's increased vasodilation. So we're trying to have them to constrict, and that's how they work to relieve those symptoms. So if we are causing vasoconstriction of those cranial arteries, that's why PVD, those coronary artery disease, uncontrolled hypertension, heart disease, history of MIs, that's why all of those things, are contraindications. Severe hepatic and renal failure, ergot, MAOIs, all of those are contraindications. But this answer choice is D, pregnancy, because it's actually safe for triptans. You can take with those. All right, you guys. As always, make sure that you like, comment, subscribe, and share with whomever you may think may find this beneficial. Also, put your stuff in the comments if there's some areas that you would like me to do questions on. But make sure you meet me back here for more questions. If you need any of our review questions, any of our review courses, our review book, any one-on-one sessions, make sure you reach out to the Nursing Studio at 803 400 6864 or shoot us an email at the nursing studio, the number one, at gmail.com. Bye, y'all.